Welcome to today's event. My name is Eva Alexander. I'm one of the board members here at Exalta Health, and I have been drawn to its mission to provide accessible, equitable, and compassionate health care to under-resourced communities. Today, you'll get to hear from our staff, our volunteers, and community partners, and we hope that you're inspired to join in our mission to serve our community.
I'm Ed Postma, President of Exalta Health. Today we are asking you to judge us by the company we keep. You will hear from individuals why they support and collaborate with Exalta Health. We will also talk about some of the organizations that work with us. We want to highlight what these partnerships have helped us to accomplish and how they will help us impact the future. Our ability to provide for the uninsured, the underinsured, and the refugee is based on the collaboration with these institutions, the company we keep.
Hi, my name is Estefania Oceguera Garcia. I'm a student at Ross Medical Education Center, completing my externship at Exalta Health Medical Clinic. Ross and Exalta Health are a great match and complement each other. While Ross prepares students for that real-life world, Exalta Health gives students that real-life world experience. A combined effort from both institutions brings health and well-being to a community in so much need of accessible health care. I enjoy working at Exalta Health and support its efforts.
As you have heard from Estefania, she experienced Exalta Health as a Ross Medical student extern. This is just one example of the many students who complete their training here. It is an honor that these institutions entrust their students to us. Over the past year, we have had first-year students from MSU. We've welcomed back Calvin University nursing students. Dental hygiene students from GRCC have come, and nurse practitioner students from GVSU.
Hello, my name is Keagan Johnson, and I'm an affiliate professor of nursing at Calvin University. My nursing students get to spend time at Exalta in both their junior and senior year of nursing school. This is such a valuable experience for them as they learn more about the healthcare needs of the community. They also spend time shadowing and learning from the clinic staff as they provide excellent care to the mind, body, and soul. This is a very valuable partnership for Exalta and Calvin. Nursing students take away much about how to provide excellent holistic care.
Hi, I'm Dobberstein. I'm a dental hygienist, and I teach dental hygiene at Grand Rapids Community College. I'm also the director for the Community Dental course at GRCC. My students and I have been working with Dr. Armstrong for about the last 5 years. When I met Dr. Armstrong, he told me about the mission of Exalta Health, and it fits so well with what I'm teaching in community dentistry, and just being able to be part of a compassionate organization that provides services to underinsured and uninsured patients is very valuable, probably more so for us than it is for the patients some days. When I first came to Exalta, I was so happy to find out that it was both an integrated medical and dental clinic, as well as providing compassionate and just spiritual, emotional support for the patients in that community and in West Michigan. Some patients who come to see us have never been to a dentist, and sometimes it takes 2, 3, even 4 appointments to get them back to health.
Our local hospital systems have been invaluable. University of Michigan West has partnered with us, increasing our capacity by placing a physician assistant once a week at the clinic to see our patients. They also have placed a virtual visit platform at Exalta Health for cardiovascular consults. This is a program which we hope will expand into other specialties. Spectrum Health continues to support us through their Healthier Communities grant. This partnership has been in place since 2005. Focusing on chronic disease management. They have decreased the cost of our lab fees and placed a financial navigator at the clinic to help our patients obtain financial assistance.
I'm Dyole Hayes, Chairman of the Board of Exalta Health. I'm also a contractor at University of Michigan Health West and an adjunct instructor at Grand Valley State University. Both of those agencies partner with Exalta Health. We provide quality health care to those people that fall through the cracks. They're underinsured or they don't have insurance. We serve about 2,500 people annually in the West Michigan area.
Hello, I'm Dr. Ken Fawcett, and I serve as Spectrum Health's Healthier Communities Vice President. Healthier Communities has been a proud sponsor of Exalta Health for nearly 20 years, as Exalta provides medical outreach to underserved, disadvantaged, and marginalized community members really across West Michigan, and does so in a way that is both dignified and uplifting. We have been a proud partner in this work, really based upon Exalta's outstanding outcomes, particularly around the management of chronic disease, including hypertension and diabetes. Exalta Health allows individuals to achieve the most equitable health outcomes possible and to live better lives.
I'm Greg Meyer, Chief Community Officer at the University of Michigan Health West. We consider Exalta Health a valuable partner in our efforts to bring excellent health care to the underserved population of our West Michigan community. In addition to our diabetes prevention collaboration, we developed a telehealth opportunity for patients who have transportation, mobility, or language problems, which will allow them to communicate with specialists here at the University of Michigan Health West. We are looking at other possibilities for collaborations as well. We enthusiastically support Exalta Health and hope that you'll support them too.
Our community partners expand our ability to serve our patients. Collaborating with Samaritath and Bethany, we are caring for refugees in our community. The Hispanic Center has placed a community navigator and patient advocate at the clinic. Michigan State, through their research for Alzheimer's, has developed a Spanish-speaking support group for caregivers that meet at Exalta Health. We host West Michigan Center for Arts and Technology billing and coding students to complete their training, and some have become staff. A grant provided by the Area Agency on Aging of Western Michigan allows us to care for senior dental patients. We have over 25 churches supporting Exalta Health by serving, praying, and giving. One group we cannot forget is our faithful community volunteers. Our volunteer base is a rich combination of healthcare professionals, administrative support, and building and grounds, and that's just to name a few. They support us by serving at the clinic, spreading the word about us, praying, and giving financially. Let's hear from some of these partners.
Hola, my name is Evelyn Esparaze-Gonzalez, and I'm the Executive Director of the Hispanic Center of Western Michigan. And today we're here to talk about the partnership, the wonderful partnership that we have with Exalta. We have our navigator coordinator in their site, and she is able to connect clients through different systems in our community. She provides transportation and services in Spanish to our clients. So we're very grateful that we can partner with Exalta Health to make this possible. We as an organization recognize the importance of having Exalta Health in our community to provide accessible and high quality health services to our community members. So we value their partnership and we support them, and we encourage you to do the same.
Hi, I'm Irving Vega, an associate professor at the College of Human Medicine at Michigan State University. I work in the Department of Translational Neuroscience. We focus on understanding Alzheimer's disease and related dementia. Specifically, we are also interested in understanding health disparities associated with Alzheimer's disease and related dementias among Latinos and Blacks. One aspect that contributes to that higher risk among Latinos and Blacks are social determinants of health. Lack of access to health care is one factor that contribute to the biological vulnerability that put Latinos and Blacks at higher risk of Alzheimer's disease and related dementia. Exalta Health provide health care to those that otherwise would not have access to. That itself reduces the risk of Alzheimer's disease and real dementia. We are proud to collaborate with them in bringing information that reduces the risk of Alzheimer's disease and real dementias among Latinos. We also collaborated in developing the first support group for caregivers of people living with dementia.
I'm Andrea Owens. I'm the medical billing instructor and success navigator at the West Michigan Center for Arts and Technology, or better known as WMCAT. My role there as a success navigator is to help students become successful in our programs. So that is to provide support for them to become their best authentic selves, also to help combat any barriers that will get in the way of their success. And so our programming is tuition free, and we also have career training in the health services area. Our partnership with Exalta is so important because our missions collide and collaborate, and we work well together. Exalta Health is a valuable partner in our work because they help provide externship opportunities for our students to become successful in the patient access and support services and the revenue cycle processes. And so Exalta Health also plays a vital role in our region by providing primary health care for the underinsured, uninsured, and the refugee communities.
Hi, I'm Steve Hall, pastor of Princeton Church in Kentwood, Michigan. At Princeton, our mission is to create people who live for God, who love their neighbors, and who lead people to Christ. One of the ways we accomplish this mission is by partnering with mission agencies and organizations. We do that by praying for them, by serving alongside them, and by giving financially. We've had the privilege of giving financially to Exalta Health for 20 years. Exalta Health's mission shows God's love tangibly to people by physically caring for them, providing primary health services to uninsured, underinsured, and refugee populations. By partnering with Exalta, we care for people spiritually and physically.
We have been so blessed and challenged in many ways during this last fiscal year. However, we have accomplished much. Our patient population increased by 27% to 2,526, which resulted in our patient encounters growing to over 9,000. What a great opportunity. What a blessing. In partnership with the Kent County Health Department, we gave over 1,300 COVID vaccines, overcoming the reluctance of a patient population due to fear, mistrust, transportation, and other issues.
Hello, my name is John Shea. I'm a musician and a native of Battle Creek. A friend recommended Exalta Health 10 years ago, and I've been a patient ever since. My first appointment was at 1 p.m., and as I entered, I overheard the entire medical staff praying to God to help them heal with caring and kindness and compassion. I've been a patient ever since. I've had Dr. Vandermolen, now Dr. Shoemaker. I've had dentistry there. I've had spiritual counseling, psychological counseling. It blew me away because here was a clinic that's faith-based and available to everyone. When I first came, I didn't have any health insurance at all, but they took me. So they take everyone regardless of status in society, how much money you make, etc. So I'm very grateful to Exalta Health for everything they do for me.
I'm Reverend Kristen Meyer, and I have the joy of serving as the staff chaplain at Exalta Health. Exalta Health's mission is to provide safe, accessible, quality, and compassionate health care. And one of the ways we do that, especially the compassion piece, is by caring for the whole person. I appreciate working at Exalta Health because Where else can you go? What other primary care medical or dental office can you walk into and hear someone say, hey, we take it really seriously here that you are more than just a body, and we think all parts of who you are as a human being matter for your health. That means your emotional life, your spiritual life, your family stuff, your life in this community. And we're going to be here to support you in all of those areas if that's what's helpful for you.
We as a community are going to face challenges as we look to the future. Inflation and the pandemic are causing increases in the cost of providing care. We believe that our costs will increase by 6 to 10% in the coming fiscal year. All of our patients participate by contributing what they can. However, 68% have no insurance and 55% are unemployed. Many of those who are employed may not have insurance. 50% of our patients have incomes less than the federal poverty index. Although there are challenges, we believe God has placed us on the corner of Andrea and Division to provide health care for those who fall through the cracks of our health care system. Our collaboration with other institutions helps to fulfill our mission of providing compassionate, safe, equitable, accessible health care for the whole person. We hope we've been able to show you the value of our ministry. Our patient population, which is a part of the greater Grand Rapids community, needs your support. Each year, we need to raise about $1.4 million to keep this ministry viable. Without your financial help, we may not be able to provide for the underserved. We are inviting you to become a part of the company we keep. Thank you for your consideration.
Thank you for joining us today. I hope you were inspired by everything you heard today, the stories, our staff, our volunteers, and our partners. Remember to check out our website at exaltahealth.org and be part of our mission with a financial gift, your time, or by helping us share the word. Thank you.